On this channel, we talk to a lot of ophthalmologists and optometrists, but have you ever wondered what it actually takes to become an eye doctor? Or perhaps you've wondered what makes somebody decide to be an eye doctor in the first place. Well, today we're going to talk to Dr. Alan Kabat about that exact subject. Dr. Kabat?
I want to talk to you.
Not now, later.
No, now.
Today we're going to be talking with Dr. Alan Kabat, who's a professor of optometry at Salus University, which is at the Pennsylvania College of Optometry. Good morning, Dr. Kabat. How are you?
Morning. I'm doing well.
Good. Well, Dr. Kabat, I know I certainly know who you are, and I know a lot of people in the industry know who you are, but since this is a YouTube channel, could you take a second and give us some background about yourself, your education, your practice?
Sure. Coincidentally, I'm wearing my Rutgers polo today. So I'm a graduate of Rutgers University, and subsequently graduated from Pennsylvania College of Optometry. I did a residency at a hospital that's no longer in Philadelphia, John F. Kennedy Memorial Hospital, which was affiliated with PCO. I then spent a brief time in private practice before going into academia. I've served at three institutions, three colleges of optometry, the first being Nova Southeastern in Fort Lauderdale, the second being Southern College of Optometry in Memphis, and now I've come back to my alma mater in Philadelphia at PCO.
Well, and I think on this channel we talk a lot with ophthalmologists, optometrists, and this will be the first time that we've spoken to an active professor on the channel. So could you talk to us a little bit about the differences between being a professor versus practicing optometry?
Well, it's quite different. I like to say and I like to think that I have functional ADHD. And by that I mean, if I'm doing the same sort of thing at day in, day out, and that was when I was in private practice, I enjoyed seeing patients, but not as much seeing them every day. And I had a lot of other things that I wanted to do. I had a lot of skill sets that I really didn't feel that they were being fully appreciated in private practice. And being in an academic setting allows me to see patients, me to also see interesting cases because we're often a referral center. So it's not all routine care. There are often some very challenging things that come our way, and I do participate in the specialty service in dry eye, so I get a lot of referrals coming my way. But also it allows me to teach. Obviously, it allows me to speak and lecture. It allows me to use some administrative talents that I have to problem solve, both in the clinic and in the classroom setting. So again, it was very different, but it was the right choice for me. I like to think. I've been doing it for 28 years, so it certainly was the correct choice.
Well, and today with COVID and everything that's going on, I imagine that things have changed significantly at the university. Can you talk a little bit about how the program has changed in 2020?
Well, obviously, having as many students as we have and being as large as we have, being a clinical facility, we have to take extra precautions. I know I have a lot of colleagues here. I live in South Jersey. I have a lot of colleagues locally who opened up, immediately after the shutdown. They had, again, they had precautions that they had to take and they had to modify their schedules, but they were ready to get going, and they were able to manage the patient load effectively. As large as our clinic is and as many students as we have, we had to take extra precautions. So we were really shut down for quite some time. We had to shift to online learning, which quite frankly is not the same. We can talk about cases and we can present interesting cases and photographs to our students, but it's quite another thing to be actively examining them and having the encounter unfold literally before your eyes. And that was something that I think they missed. We hope that we kept them engaged and we expanded their knowledge base, but there is nothing equal to seeing patients live in a clinical setting. We've just started back recently. In fact, yesterday was our first day back with our third-year students. Our fourth-year students have been back on a modified schedule for at least the past month or so, month and a half. It's a bit of a challenge working with all the PPE and the modified schedule, and the patient flow has changed, and some of the testing that we normally would do, we can't do because of risks of COVID. So we've had to modify and we've had to adapt, and it is challenging, but we're doing the best we can to serve the needs of our patients and to educate our students. And I think doctors, optometrists, ophthalmologists, no matter what setting they're in, are dealing with these new modifications as best that they can, and really just trying to serve our constituents as best we can.
Well, and I certainly think that that's a problem that we're all dealing with. I don't think anybody should be surprised that there are changes at their school or changes at their doctor's office, because there are changes everywhere. That's what's going on.
Yeah. It's frustrating for somebody like me. I'm not that flexible, I've been told, but and it's frustrating. But again, we all have to understand that it's something that we have to do. There are rules that we have to follow, and we're going to overcome this just like anything else. But again, I would be lying if I said I wasn't frustrated.
Yes, well, I think everybody's dealing with some frustration. So I think what you just described is the current the way the program looks today, and I would call that a worst case scenario. But if I were somebody interested in becoming an optometrist or going to optometry school, what could I expect, or what advice would you give somebody that's making that consideration?
Optometry really is a great profession, and it has so many avenues that I didn't appreciate when I was a student. I really went through thinking, well, okay, I'll graduate and I'll get my degree and my license and I'll see patients, and that's that. But there really are many more avenues to follow. Since I graduated, and that was 30 years ago, we've expanded into a variety of subspecialty areas. Again, they're not officially recognized, but we recognize in the profession that we have folks that are exceptional in the contact lens arena. And we have folks who are exceptional in pediatrics, binocular vision. Traumatic brain injury is another area that optometry has really gone into and done some excellent things. Ocular disease specialists. I have colleagues who work side by side with retina specialists who have the same knowledge. They're not surgeons. They don't do the surgery, but they're excellent diagnosticians, and they're worth their weight in gold in those practices because they can see the patients and they can make the diagnoses and order the proper testing and refer, and really take some of the burden off of the retinal surgeons. And on and on and on. We see folks in research. We see folks in academia, obviously. We see folks in industry. So the profession is wide open. And I think what I would say is it is a unique field. It is it's not considered medicine. So there is always that little, well, you're not a medical doctor. And that's true. You can't fight that. But we certainly are specialists. In our area, we have very unique knowledge sets and skills, and it translates into a lot of areas. So, I still think the future is bright for optometry. I think that, we have to embrace the other roles that we can play, because not everybody is really cut out to be a clinician, and there are other skill sets. I myself, like I said, I got frustrated early with just seeing patients, and I felt that I needed more. And thankfully, there were opportunities in this profession that I could take advantage of and find a place for myself. But as far as someone who's considering the field, it's a wonderful field. It's an honorable field. It's an open field. The pay is good. I mean, I know that's not supposed to be a priority, but it pays well. Optometrists make a good living, a good salary, and it enables us to do things that we want to do and live a good life. And the people in our profession are also top notch. The leadership at all levels are really wonderful people. I'm very glad that and proud to call myself an optometrist.
Very good. Well, and just in terms of, an optometry program in general, like if I were to get into an optometry program today, how much of a commitment, how many years are we talking about here? What's the commitment look like to get into an optometry program? And frankly, what kind of requirements should I be meeting before I even apply?
Well, it's an interesting question because there's a variable answer. So my institution, Pennsylvania College of Optometry, I believe has the only accelerated program in the country right now. We actually have a scholars program that has very high requirements. It's a very high bar to meet. But for those individuals who have performed well and who do have the credentials and are willing to take on the additional challenge, they can graduate from our program in 3 years. In most institutions, and we have our traditional program as well, which is 4 years. So typically it's a 4-year commitment. Most people matriculate after 4 years of college. Some can matriculate after 3, provided that they have the proper requirements. So a bachelor's degree for most schools is not required, but you will earn it during the course of your optometry school profession or education. So everyone will ultimately finish with a bachelor's degree and then a doctor of optometry or OD degree. As far as the requirements, yeah, obviously it's heavy in sciences, as all healthcare professions would be. So the biology, of course, the chemistry, the biochemistry, physics, optics is important in optometry. A lot of us forget about that, but that is the bread and butter of the profession is optics, which is basically physics. So math is important, and the prerequisites are laid out there. But I would also tell people who are interested in this profession to determine if they have an aptitude and a love for healthcare. And the best way to do that is to volunteer and to go into a practice and spend some time shadowing an optometrist, an ophthalmologist, some healthcare provider to see if this is something that you could picture yourself doing, is caring for patients and addressing the needs and concerns and illnesses of patients. Because, again, not everybody who goes into it realizes what their life is going to be. So that's a big part of it. The academics, sure, you can get in on your academic record alone. But I have seen a number of students over time who were excellent students who were not excellent healthcare providers. They just didn't have the love for it or the skill set for it. And so ideally, individuals need to determine that before they matriculate and need to know that this is the course that they want to pursue and this is what they want to do for their career.
I'd like to get your opinion on something. I think obviously we were talking earlier about changes that have happened at the university, changes that have happened in practices, and from an academic standpoint and just what you're seeing in the industry, how much of these changes do you think are going to stay around after COVID? How many do you think are good things to keep around? And how many of these do you think are just sort of stopgaps?
What a lot of entities have realized and are realizing is that while face-to-face meeting is great, I really miss being at conventions and seeing my colleagues and having one-on-one time. We can get a lot done virtually, this is one example. We can get a lot done virtually, and I think we're going to see that a lot of our meetings, I think a lot of our education can be done efficiently virtually. Me sitting in my office in my home, getting the education. It really was a very minuscule aspect, and a lot of the states and a lot of the local regions required that the education be live. We've relaxed those rules in many states, most states. I hope that that's going to continue because I think it takes a burden off of the practicing clinician. I hope to see that there'll be more remote education because I think doctors can learn in this environment very, very well.
So Dr. Kabat, thank you so much for being with us today. I know we've taken up a lot of your time, but I do appreciate you being here. As you said, we're working remotely. We're going to make this through it together. But again, thank you very much for your time this morning.
My pleasure chatting with you. And to anyone who's watching this on YouTube, I wish you the best. Stay safe, stay healthy. And my final plug for optometry, it's a great profession.